I'm telling you. See, blood tests, you got to remember, is like this country's gospel. You know, everything, if it's not in the blood test, or your blood test says this, we have accepted that as our gospel. But blood tests are not the only way of checking things out. You know, you have a lot of other ways to check things out. Most physicians will tell you after you get a blood test, your cholesterol is high, you got this high because the blood test says this is out of range. But that's one test. And then you got to ask yourself, how come you go to the doctor one year and you have this problem, you go to the doctor the following year and you have a problem that they didn't find? It makes you wonder about the approach. Now, the things that I did with the gentleman up front, I can go back in his childhood. It looks crazy to some of you, but I can go back to his childhood and find out things using those different modalities because the imprints are still in his body. The markings are the same. There's going to be changes, but I didn't know him. And I can do that with anybody in this room. I've been doing it now 30 years. I mean, it's like a walk in the park for me. It works. But what you have to do is start, like you go to school for things, you have to start educating yourself so that you can make choices that work for you. Not what Dr. So-and-so says, not what I say, Dr. Miller or Dr. Regis. What have you found that works for your body? You see, because everybody's different. You know, I'm not even going to try to change your belief system, but I'm going to introduce you to some truth that I've learned over the last 30 years. Now, what you do with it is up to you. Now, if you sit there and drink coffee, don't drink water, I'm going to make a prediction. You're going to have problems. If you eat a whole bunch of red meat and chicken and everything else, I'm going to make another prediction. You're going to have a lot of other problems. Now, if you're on a plant-based diet and all these other types of things, they're going to be able to determine certain things too. But you, and this is the problem that many of us physicians have, is getting the client to do the work, to exercise the discipline. You know, you come to us and you want results, but I don't go home with you at the end of the day. You know, you're going to be at your kitchen table. You know, what I eat don't make you go to the bathroom. You see? So we got to really get down to you doing the work. You know, not what Dr. Such and Such says is the head of the medical association. He went to school just like everybody else and just like you can. You got to start doing some specific homework about your specific problem, and you got to make time for it. We make time for everything else but ourselves. That's right. We go to work, we go to school, I ain't got time. And you know, and I said earlier, you get religion when you get a problem. You get cancer, I ain't never seen so many conversions. I got prostate cancer. Dr. Wyatt, I got to do whatever you tell me. You see? So you got to do the homework, my brother.